specific areas of our counties, and East Oakland is one of the areas in Alameda County. So I think it was very, very important that President Dufresne joined us to give us some perspective, because I know just like we all want to be safe and healthy no matter where we live in the county. So I think it's really, really appreciative of your joining us. Once we hear from our folks, then I will ask the questions that many of you have submitted to me in advance, and we'll have kind of you'll hear their responses, and I may prompt some other questions, but that's how we'll handle today. And I want to thank my staff for organizing it and for setting up, arranging these wonderful folks who are joining us, these experts who are joining us. And we'll start now with Dr. Rutherford. Go ahead.
Thank you very much, Senator Skinner. It's a real pleasure to be here and to be with among my fellow constituents. And on behalf of UCSF, let me thank you for all your service at state government. One of our major hospitals, now renamed UCSF Benioff Children's Hospital, Oakland. Dr. Walker was wondering where I was going with that new name, is part of your district, and it's thank you for all your help. So I was asked to talk about a few things, so let me just start. We're currently in not particularly great shape as a state. We had a spectacular response early on, and especially in the Bay Area, where we not only flattened the curve, but we stomped it, squashed it, whatever you want to call it, and had peaks in April, mid-April, where we were able to accommodate all our intensive care and all our inpatient people with COVID-19 without a lot of difficulty. However, since Memorial Day, across the southern United States as a whole and on the West Coast, cases are rising. And in California, the cases have risen fourfold per day since then. And we're currently running at over 10,000 cases a day in California. In the Bay Area, we're at about a tenth of that. We should be at an eighth of it, but a tenth of it. So we'll take that as something of a victory. And we've had actually, while every death is a tragedy and it's a life cut short, we've had many fewer deaths than we should relative to the rest of the country or relative to the rest of the state. How do we get it back under control? Well, the governor's taken definitive steps here recently to turn and bring the curve back down. I think we have to give that a couple of weeks to work minimally. Additionally, as testing expands to the extent that it can expand further, that will certainly be of help. Where it is now, especially with some of the commercial vendors, for people who are at lower risk of infection, isn't particularly helpful, again, with 7-day turnarounds routinely. So the prevention of this disease is all about you, and it's all about you and your behavior and the behavior of people around you. Far and away, the most important thing you can do is to wear a mask every single time you go out your front door. And the reason you wear masks is because there's a lot of this disease that's transmitted asymptomatically. That is, people do not have symptoms and they are infectious and they can spread it. And you don't know you have symptoms. You don't know whether you need to put a mask on or not. So the advice is simple: put a mask on, period. Okay. And I don't care if you're exercising your dog with 1-inch legs or you're running a marathon, put a mask on. You can put a gaiter on, you can do this, lots of choices, but put a mask on. The other things we like is because this is primarily transmitted by droplets, and respiratory droplets respond to gravity, and they can only go about 6 feet. We want people to have physical distancing when they're out and about, and especially if you're indoors. I can't emphasize that enough. We get away with a lot of stuff when we're outdoors that we shouldn't be getting away with. But if you're indoors, it's going to catch up with you and it's going to be bad. So physical distancing is important. And then also another thing that we've worried about over the months now is about so-called fomite transmission, that is picking the virus up from surfaces and then rubbing it in rubbing your eye or rubbing your nose and self-inoculating it, not on purpose, obviously. And that's why we ask people to wash their hands frequently. That's, I think that's a nice adjunct, but the main thing is wearing masks, period, over and out. What can we do? So that's on you. What's on us?
Can you just quickly, since you're an epidemiologist, can you explain? Obviously, I think we all know how a mask keeps my droplets from spreading to someone else.
Right.
But now there's increasing evidence that my wearing the mask also protects me. Can you explain that?
Sure. So you get most of the bump from masks at a population level from people who are asymptomatic wearing masks and cutting down their respiratory secretions. Okay. And by cutting down, I mean 96%. Okay. If you happen to be standing, if someone's coughing or sneezing, it obviously doesn't work as well because there's more force behind it. If you're unlucky enough to get in the pathway of that, you having a mask on will cut down your chances as well. It'll cut them down quite substantially. Because the lining of around the eyes, the conjunctivae, are part of the respiratory epithelium. You can actually get it there, which is why we worry about people rubbing their eyes. The third part of this is that if people wear masks and they're cutting down the amount of virus that gets out, people who happen to get infected are probably getting infected with lower doses of the virus and may have more asymptomatic disease or less symptomatic disease as a consequence. So those are three good things about masks. Contact tracing is something that's on us as the government. UCSF and UCLA have been trying to train a large contact tracing workforce for California. We have something that's pretty sophisticated and well established in San Francisco. Some of the other counties are coming up to speed on it a little bit more slowly. But UCSF and UCLA between us have trained about 7,000 people statewide to become contact tracers assigned to local health departments. So that's good because the idea there, what's the intervention that's going to stop this? The intervention is going to find people who are infectious, who are capable of transmitting the infection and putting them into isolation, okay? So they're not going to be in contact with other people when they're most infectious. That's the intervention. Contact tracing is a means to that end. But I'd also say if you're going to take somebody who's poor, living in high density housing, having to go out for work every day, getting paid day to day, and put them into isolation for 7 or 8 or 9 days, they're going to have no income stream. They're going to have no support. They may not have a place to isolate. They may be sharing their apartment with 4 other people or be in a big multi-generational family house. So we also have to have places for people to isolate. We have to have social services for them. We have to have income replacement. Then if they have a formal job, they have to have rights of return to that job. So it's a complicated proposition, but again, we're working through that. Why is testing challenging? Testing, as you know, there are these long backups. The governor is, I think, issued quite rational guidelines about who gets tested first. They're starting to run into supply issues. This is not so much the people and the machines as it is the little parts that you need, little plastic parts for the tops of tubes, stuff like that. That supply chain is going to catch up, but there is a big crush on testing. We're at 2 times more than we thought we would need, and we're starting to see backups from that. I'm not sure what it's like in Contra Costa. In Alameda, I know that it's fairly backed up, and in the city, it's badly backed up. So that's what I was asked to cover. I'm happy to answer questions. There are lots of lessons we can learn from other places, and this is one of the things I'm scouting every day. My new favorite is that in Denmark, they blocked off all the streets around the schools and put all the desks out into the street and and portable chalkboards. And, that's going to be great until it starts to snow. But,
well, Dr.
Thank you.
Rutherford, really, really appreciate it. Now, I understand that when we started, the technical people who are supposed to have had this all set up, we started before everyone observing could see us. So let me just quickly start over. everyone participating did get to hear all of you, Dr. Rutherford. What they didn't hear was our opening and my introduction for any of our other folks. So good afternoon. I'm Nancy Skinner, State Senator for the East Bay in Senate District 9. This is our 7th virtual town hall around the COVID pandemic. And we're holding this one today with experts, health experts, because a lot of us are confused. While I think messaging has been clear, it has varied because it's been very dependent on how prevalent the virus is and how much it's spreading. And I think we've seen sort of, businesses get to open, businesses have to close, and a lot of people would like to have what I'd call is a degree of pandemic normalcy. And maybe we haven't felt that as much lately. And so today is our opportunity to hear from our health experts. How can we achieve that pandemic normalcy? I say pandemic normalcy because we will not achieve whatever we considered normal before when the pandemic is still present and without while the pandemic's still present. So we just heard from Dr. George Rutherford, who's an epidemiologist and is at UCSF Medical School. And he is also an advisor to the Centers for Disease Control and other agencies. And we are next going to hear from Dr. William Walker, who is the head of government and legislative affairs for Contra Costa County Health Services. And he will be followed by Anika Chowdhury, who is with our Alameda County Health Services. And they will both talk about what there are respective counties, what their guidelines are right now, because while the counties must follow the state's overall guidelines, it is the counties that get to, in effect, direct us as residents of counties as to what the rules are for our particular county. And so they'll explain why and what those rules are within our counties. And after that, I'll introduce Preston Dufouchard, who will speak after they do. So Dr. Rutherford, go ahead.
Dr. Walker.
Not Dr. Rutherford. Dr. Walker, please. Yes.
Thank you very much, Senator. And thank you also for your leadership, not only in this, but in many aspects of healthcare in California for all of us. So following Dr. Rutherford, I really want to thank him for totally explaining the science of why we wear masks. And
Totally.
And we, along with Alameda, were among the Bay Area counties that very early on in March came out with health orders for stay-at-home orders. And we, along with all the other Bay Area counties, now are also experiencing the rise in new cases. For a long time, we've had masking advice and masking orders. You know that we ran up against, in some counties in California, some opposition to that. It was very helpful when the governor came out with his statewide order about masking. And now the question is, how do we get people to mask? Because we still have people who are not masking, who are still not following social distancing, and who are actually contributing to our new cases. Contra Costa County is one of the counties that's on a monitor list, as all the Bay Area counties are, and which means that in our situation in the Bay Area, schools cannot open up for in-person learning until the county has been off the monitoring list for 14 days. So all of us are running up against August now, when schools will be opening with distance learning only. There are some exceptions for elementary schools who can apply specifically with their superintendent for a waiver that has to be approved by the local health officer and by the state health department. Right now in Contra Costa County, in terms of hospital utilization, we're actually doing fairly well. We have 101 cases in the hospital right now. We've had 103 deaths, one more in the last 24 hours. Of our 103 deaths, 70 have been in skilled nursing facilities. So you can see that a lot of the impact in Contra Costa has been in long-term care facilities. And we have special strike teams and a lot of staff dedicated now to working with our skilled nursing facilities to help them do infection control. In fact, we have a system whereby if a long-term care facility has one case of a resident or one case of a staff member, they're put on a watch list, on what we call our outbreak list. And of the of the nearly 100 skilled nursing facilities and elderly care facilities in Contra Costa County. We now have 15 who are on the watch list, and we're communicating with them daily. We're working with the state on bringing the cases under control, but that's where our emphasis is right now. Dr. Rutherford mentioned the testing issues. We actually, several weeks ago, had a plethora of testing availability in Contra Costa County with rapid turnarounds, and we actually were offering at that point for anyone who wanted a test to come in, including all asymptomatic folks who just wanted to know their status. As Dr. Rutherford said, there's now been a nationwide shortage of not only the reagents, but also the pipettes and the other kinds of platforms that are needed for doing the testing. In Contra Costa right now, in our own public health lab, we luckily can turn around and test for in 24 to 48 hours. However, that's a much lower volume of tests that needs to be done in our entire county. And so we rely also on the commercial labs such as Quest and LabCorp, and they're running 7 to 10 days now in terms of delay. So if you're talking about contact tracing, which is all what we're gearing up to do, we now have 135 employed contact tracers. We've got another 20 from the state. We'll be getting another 30 in August, so we'll have 185 contact tracers. But a contact tracer can't work effectively if a patient doesn't know that he or she is positive for 7 to 10 days. And so until we actually resolve this testing issue, we're all going to be behind the 8 ball. The state has a task force now that's working very, very diligently on this. They're working at trying to maximize the use of all the laboratories in California. If all of them were being used to maximum capacity, we could be doing 200,000 tests a day. Right now, we're doing around 120,000. So we have a long way to go. And again, if we can solve the technology, we'll be a lot better off. I do want to go back to masking, and that is that our Contra Costa is taking this masking issue very seriously. We're now going beyond advice. We're going to enforcement. And so on the Board of Supervisors agenda on Tuesday, there will be an ordinance that the Board of Supervisors will deliberate on, which actually allows anyone who's violating the masking order in a non-commercial setting to be fined for the infraction. They'll first be warned, but in subsequent violations, the fines can go $100 for the first violation, $200 for the second, and $500 for the third violation of violating the masking ordinance in particular. For commercial activity, that is in businesses that are not following the social distancing, the masking, the kinds of requirements that we're asking all businesses to comply with, the fines are a little higher. And they start with $250 for the first violation. They go to $500 and then to $1,000. So no one ever thought that we'd come to the point where we'd actually have to have enforcement and legal activity involved in making people wear a mask, which seems like such a simple thing to do. But the masks have, in some cases, become a political kind of message. In some cases, it's simply people who don't want to be told what to do. But actually, we're telling people what to do, not necessarily as much to protect themselves, but to protect their neighbors, their families, and the people around them. And that's not too much to ask. That's what we ask people to do when they stop at a stoplight. So where we are now is basically tenderly moving in the area of enforcement here. We have, as I mentioned, a number of issues to deal with regard to school openings in the fall. That's going to be an entirely another issue that we're all dealing with. But that's where we're at. So I can be available for questions. You're muted.
Still muted. Thank you, Dr. Walker. Really appreciate it. And I'm sure we'll all be interested to see what the County Board of Soups does regarding the enforcement of masks. I will note for everyone watching that when the state Senate returned to session, we had not been meeting in the Capitol, but when we returned, and we have plexiglass around our desks, we are required to wear masks. There was on each of our desks an article from 1918. It was 1918 or 19 during the Spanish flu epidemic. And California did have a mask law, which they enforced. And the article had a photo in front of the state capitol where 2 California legislators were either being arrested or given a ticket because they had not worn masks. And the point of the article was to show that even the legislators were not above the law, and that the state during that time was enforcing masks. So I thought that was a very interesting thing to see, and that it was put on all our desks because, of course, just like any other group of humans, we had people in the legislature who didn't like wearing masks either, but now they seem to be. So that's good.
If I may pile on for a second, the mayor of San Francisco also got a ticket from his own police force for not wearing a mask, but was able to pay the $50 fine on the spot.
So that was in 19, I think it was fall of 19 when that San Francisco. Anyway, so we will have many questions for our county officials, but let's go next to Anika Chowdhury, who is our county health services department for Alameda County. Anika, please.
Thank you, Senator. Good afternoon, everyone. So this weekend in Alameda County, we are actually on pace to hit 10,000 cases since the pandemic began. And so we've seen a steady increase and a steep increase in cases and hospitalizations over the past 7 weeks, especially which coincides with the last time we opened a bunch of activities, which was on June 4th. And so I do want to acknowledge that those numbers include the city of Berkeley, which is unique in that it has its own health department, but we partner really closely with them. Because of that increase that we were seeing, we hit pause on our reopening plan on June 29th and decided that we weren't going to open any more sectors because as Dr. Walker said, and as Dr. Rutherford said, it's something that we're seeing across the state, across our region. And in the Bay Area, there is such a high, exchange of people and commerce. So we were also local health jurisdiction number 59 of 60 to apply for variance attestation, which allowed us to open up the zoo and preserve outdoor dining. And so, but other than that, we've kept everything on pause. And because of the elevated disease conditions in our county, we did end up on the state's monitoring list on July 12th. And so this means that we're subject to state restrictions, including just like Contra Costa, not being able to open schools until we're off the monitoring list for 2 weeks. And we've also had to suspend indoor worship services and indoor malls. Other than that, because we moved really slowly compared to the rest of the Bay Area counties in terms of reopening, we didn't have a lot of other sectors that we had to close back down after the state put in place their restrictions. And so, when we look at our data to kind of understand before and after June 5th, what we're seeing is that the cases are now mostly in younger adults, with almost 65% of them being among people who are between the ages of 18 and 50. We're continuing to see the racial and ethnic disparities persist with our Latinx residents more than 6 times likely to get COVID-19, and our African American residents twice as likely to die from COVID-19 compared to our white residents. And so, equity is infused throughout our response, and we are working really closely with our CBO partners and our community partners to make sure that we are leveraging the full network and the full breadth of our county's availability to be able to serve people. So for example, West Oakland Health Center is going to be partnering with us for hiring more contact tracers so that we have cultural and linguistic competency in how we're approaching that work. And then lastly, over the last month, especially, we've seen more people becoming infected by attending parties and social events and family gatherings. And while those aren't the only places that we're seeing transmissions, social gatherings are playing a much larger role than we anticipated. And so, I think coupled with not wearing masks or not staying 6 feet away, it's just kind of really amplified the situation. And so we're doing a big messaging push. We haven't gone the route of enforcement, but partnering with our cities to message to people that they need to wear masks and they shouldn't be gathering, and they should be staying home. We launched a Mask On campaign, which includes posters and sort of visuals. And we also provide free face coverings, reusable face coverings to a lot of our residents, including through our WIC clinics. And then with regard to testing, we're also meeting our goals, but anticipating what we're seeing with the shortages happening around the state and around the country, we have recently started doing a messaging push with our employers to ask them to not require negative testing for their employees to return to work. And so we found that at one of our sites, 25% of the people who were requesting tests were people whose employers were asking them to test negative so that they could go back to work. And there's just not much utility in that. And if they have completed their isolation time, they're not infectious anymore. And so they should be able to go back, and we want to preserve tests for people who are really high risk, like our long-term care facility folks, as well as other people who need to get tested in a timely manner. And then with contact tracing, so we're working toward our goal of 300. As I just noted, we're deploying a model. So we have about 93 county staff on board and another 40 in the pipeline. And then we are going to be issuing a big RFP in the next couple of weeks to partner with community-based organizations to have them hire folks so that they can become embedded with our contact tracing process. So I'll leave it there, and we can leave it for questions.
Good, I'm not muted. So thank you so much, Anika. Really appreciate it. I've, in addition to the questions that my constituents sent, I have written a bunch down from what what you've all said. But I'm very, very happy to now introduce Preston Dufouchard, who is the CEO of the, get the title correct, hold on one second, of our West Oakland Health Council. And the West Oakland Health Council is a consortium of the community-based clinics and other health services that have been providing services to East Bay residents, health services, for over 50 years. And Preston, I'm really glad you joined us, because I know that, as I mentioned in the beginning, and there were some people may not have been able to watch at that point, that while we know cases are up in our two counties, maybe not as high as elsewhere in the state, if we were to do a very pinpoint map in our two counties, it's in specific parts. So like in Contra Costa, now I know that the numbers are up in Richmond and San Pablo, for example, and maybe a few other communities, but not everywhere. And in Alameda County, they're up in Oakland and maybe a few other communities, but not everywhere. And so the more all of us know what to do and how to keep safe, then the more everyone will. Preston, go ahead.
Thank you, and thank you for having me. I just want to say that in response to a pandemic of this nature, it's important for all of us to have collective action, which is represented by the panel that you have on this town hall. We have the West Oakland Health Council and other community health clinics have partnered with the county to do testing, not only of our own patients, but community-based testing for anyone who lives or works in Alameda County. Obviously, there's a hierarchy. If you feel like you've been exposed or you're an essential worker, then we would encourage you to come in to get tested. But we've been testing here at West Oakland at 7th and Adeline since the beginning of June, and we've done over 6,000 tests. Our positive rate is about 3%, a couple of hundred positive tests. We hope to expand testing to do some mobile testing, particularly in the East Oakland area, because that is one of the areas where there are higher positive rates, lower testing availability. So we're partnering with the county for that too. And I do want to sort of amplify something that Anika from Healthcare Services Agency mentioned with regards to the uptick in positive rates, because we have seen that uptick in our positive test results as well. And it's unfortunately a little bit anecdotal at this point, but I feel like there was a lot of markers that needed to occur, particularly around high school and college graduations, where people wanted to mark that occasion for their family members and sort of expanded their bubbles, and had internal celebrations and perhaps 4th of July parties without necessarily wearing the masks or without physical distancing. And so that may be reasons why there have been some upticks. We know that in certain industries, food delivery services, as well as construction industry, there seems to be a higher rate of infections. And while I think it's important that we ask people not to request or require their employees to test negative before they come back to work, we are seeing some employers actually drop employees off at our testing stations in order to be tested, so that they can come back to work. And I have heard of instances where employees don't actually want to be tested because they don't want to be tested positive and have to report that to their employers because they fear losing their job. And I think we need to all get over that, from not only a public standpoint, but from a private employer standpoint, and have some job security associated with the positive test results for employees. Some of the barriers to compliance, as I mentioned before, after being sheltered in place for a long enough period of time, I think people really did feel the need that to get out and see other people. We're social creatures by nature, and the desire to expand our bubbles is sometimes difficult to get over. But it is important that if you do get out and see people you haven't seen in a while, that you wear a mask and you do it outdoors, because inside increases the propensity for the disease to travel and for infection to occur. If you could do it outside, I've had Zoom calls, Zoom conference cocktail parties, which is, it's not the same thing, but at least you do get to see people. And then I want to say there's not been a whole lot of community education around masks. And so the community health clinics are going to make a big pitch around the importance of having masks. And particularly our patients can't always afford or don't always have access to masks. So we hope to provide some distribution for people who can't afford it, to have masks, and educate them on the importance of wearing masks, because it is critically important, as Dr. Rutherford said, in not only preventing the spread of disease, but they do actually protect you as well from infection. We are partnering with the county as well to do contact tracing. I mean, it is a huge job, and given the nature and the infection rates we've seen, the county doesn't have all of the staff that it needs to do the case investigations and contact tracing for the positive patients. And so the community health centers, not only the West Oakland Health Council, but Native American, La Clinica, are also participating in that. I believe Tiburcio Vasquez in South County as well are participating in helping the county do some of the contact tracing. And I also wanted to echo the statement made by Dr. Rutherford, and I believe Dr. Walker as well, about the uptick in cases in skilled nursing facilities. We've seen that as well. I will say that for our own patients at West Oakland, we've had good results. We obviously see the higher infection rates among Latino and African American patients, but we've had good results in our patient population. And while there's no cure for coronavirus, one of the ways that we make sure we care for our patients is in making sure they have the underlying conditions under control, whether those underlying conditions are hypertension or asthma or diabetes, making sure that those underlying conditions don't compete with the ability for our patients to survive an infection. And so we've had good results by making sure we're monitoring those underlying conditions and taking care of people. So that's it from the Community Health Center, but I think there has been a growth in our understanding about the nature of this disease, but also the importance about community testing and the community response.
So Preston, really appreciate your sharing that, and all of you for sharing what you've shared so far. And I think when I opened, and because people jump in and out of these Zoom type events, I'm going to remind everyone I'm Senator Nancy Skinner. We just heard from Preston Dufouchard, who is the CEO of the West Oakland Health Consortium, which is or Health Council rather, which is a consortium of a whole lot of different health services that have provided health services to East Bay residents for over 50 years. And we heard from Dr. Rutherford, who is an epidemiologist and advises many of the national and international health organizations around this virus. He's also at UCSF. And then from Dr. William Walker and Anika Chowdhury, Dr. Walker from Contra Costa Health Services and Anika from Alameda County Health Services. Now, you all gave us numbers, you gave us various things that experts talk about. So let's just break it down to regular people. Not everyone has, well, let's go to this thing of, we're saying everybody needs, not everybody, but that testing, that if we had testing, that we could control this so much better. And yet, as you all acknowledged, we don't have the ability to do the testing we need, and we can't get the results fast enough. So, and I think you've all acknowledged that the state is trying to fix that, but that's the circumstance we're in right now. We can't get the tests per se, and we don't get the results fast enough. So if I can't be tested, and I know that people can give me this virus without their showing any symptoms, so they may not even be aware. Just break it down. And I want to assume that everybody listening to this and everyone throughout my district, they just want to stay safe. What do we do? What's your sound bite message? What do we do? Doctor?
Wear your mask, period, over and out. Simple as that. Testing is not a magic bullet in and of itself. Testing helps us diagnose disease. It helps us with contact tracing. It helps with a few other things. But, getting a test is not going to prevent you from getting this disease. You need to prevent you need to prevent getting the disease yourself. And that means wearing a mask, socially distancing, especially inside, staying home if you're sick, and washing your hands.
Okay.
The big
Preston,
four.
do you want to add anything to that? Do you have any?
I would add to that, just using the word social distancing is kind of brings up the idea of
Right.
staying 6 feet away from someone on the street, but actually it's much more important to avoid those kinds of backyard barbecues, getting together with folks socially. Even outdoor church services, which are now permitted, ought to be separated. We're just asking people to make very common sense of the fact that if you're getting close to anybody, particularly if you're close enough to a person to be within 6 feet for more than 15 minutes, that's a close contact. And that's a definition of a contact with a positive person. So we really need to be extremely careful with that. And then beyond that, the importance of hand washing is extremely important. And those kinds of businesses and schools and every place else that have folks ought to have hand washing available.
So Preston, as you mentioned, we're social animals. So I appreciate, Dr. Walker, how you just described that, the backyard barbecues can't do them, but it's summer, we're going to do things. And so Preston, what's your advice? If I want to still see my friends, which we know people are, what do you tell people? What do you tell those people that come into your different health services?
What I say is, look, everyone's health and well-being is their own personal responsibility, but this is a little bit beyond that. I think you need to take not only your own health into consideration, but the people's health who you care about, whether that's friends, whether that's relatives, whether children, grandparents, parents. I think it's not so much whether I get the disease. I would feel badly, horribly, if I gave the disease to someone who wasn't able to cope with it as well as I could. So it's not only about being responsible for your own health and safety, but for those who you care about.
So Anika, maybe you can try this one. Anybody else can add. But, Dr. Walker pointed out that of the deaths in Contra Costa County, 101 deaths, that 70 of them were people in a skilled nursing facility. And the breakdown is not quite as high in Alameda County. We've had a lot of skilled nursing facility or people in assisted living deaths. We've also had community deaths. But either way, it's very high if I'm in that kind of what we call congregate setting. So, okay, me and my friends, we don't live like that. We don't have any relatives in skilled nursing. So why do I need to care about it? I don't know anybody who died from it. So, what's the big deal?
I think it's a matter of, because even though we've been living and breathing and thinking about this virus for the past 6 months or so, it's super new and we actually don't know anything about its long-term effects, right? So it could be that you get a very mild illness now, but then, maybe years from now it triggers something else. Or there are instances of, early on, I think the evidence was pretty clear that older people are getting sicker from it and are more likely to die from it. But there's plenty of reports of younger people dying. There's plenty of people who, think that they're otherwise healthy. And so we just don't know. And I think that unknown is a little bit, it should scare people. Because, and as Dr. Rutherford said, in the absence of a vaccine or some sort of treatment, your best bet is to just not get it. And so whatever you can do to avoid getting it, avoid passing it on to people, is the right thing to do. We just don't know what it can do.
Okay. And Dr. Rutherford, do you want to add anything to what we know that it can do to someone? So even if I get COVID-19, I seemingly recover. What other damage could I have? What other potential permanent damage might I have that I'm not aware of?
This is an evolving field. And we don't, obviously the first cases were in December, so we don't have real long-term follow-up on people. But there appear to be a variety of longer-term sequelae that are not well characterized yet, but that involve the brain and some other less important organs. I don't know if people know this, but the 1918 influenza had a complication called encephalitis lethargica, just like it sounds. It made you very lethargic. And that it was later believed to possibly lead to a rise in Parkinson's disease, 4 decades later. So this is not stuff to be messed around with.
I appreciate that. So some other questions. So Dr. Walker, you mentioned that Contra Costa County Board of Supervisors looking at putting in enforcement for masks.
Right.
And Anika, you indicated that Alameda County is not going that route. So most of us who live here, maybe my grocery store is in Contra Costa County, but I live in Alameda County, or maybe the work I go to is in. should we be just enforcing? Should everyone be enforcing? How do we make sure that people are not confused about, again, different rules?
Well, it's different rules, but the same message. The message, whether it's public education, whether it's advice from your doctor, from your health center, is wear a mask. And Contra Costa County is saying that in a broader version. We're saying you have the advice about wearing a mask. We know how important it is, and it's important enough to begin to diminish the spread of the virus in Contra Costa County that we want to pass an ordinance to make sure that we're doing everything we can as a county to prevent that spread from happening and for killing more people.
Okay. What else is potentially different between Alameda County and Contra Costa County? Maybe, Anika, you could just briefly again, what restrictions are there right now in Alameda County?
So Alameda County, we basically have allowed anything that can be done outdoors. We've effectively allowed that, but we don't have, we didn't open indoor dining. We don't have movies or restaurant, theaters. We don't have, I'd have to bring up my little grid. But for the most part, we've tried to look at it on a spectrum of risk. And if people can do something outdoors in a small group, we've allowed that. So for example, outdoor exercise classes, outdoor fitness classes are allowed in small groups with appropriate physical distancing and masks. But we didn't open up gyms, indoor gyms. I think one of the thing we hear the most often, complaints from the public, is that Contra Costa has pools and our pools are not open, and that is a lot of people hate us for that. So but that's one of our next things that we would like to open once our case rates are in a place where it's safe to do so again.
And Dr. Is there anything, now we know pools, but is there anything else that's different in Contra Costa than Alameda?
We likewise had not opened up indoor dining or movie theaters or those kinds of activities. We, however, in following the governor's advice, are now allowing outdoor haircutting.
Okay.
Mm-hmm.
But not outdoor nail salons.
All right. So in Contra Costa County, I can get my hair cut as long as my hair cutter can do it outside.
That's right.
Now in Alameda County, can I get my hair cut?
Not yet. Got to keep wearing it like this because, and that's partially because, since we hit pause on our reopening, we just haven't opened any other things. And then we ended up on the monitoring list in between that time. And so we're not, even though the state allows the outdoor hair cutting, our local orders don't. And so we're not opening anything new at the moment.
Okay. I'm going to go to some of the questions the constituents sent in. They asked, let's see, can we buy N95 masks now, or are they still being prioritized for healthcare workers?
They're still being prioritized for healthcare workers. There are some places that are well supplied right now, but we also have spots of shortages in various hospitals around the state. So we're recommending that the N95s be reserved for healthcare workers and those who are having close contact with positive patients.
Okay. Similar to the questions I've already been asking, it was, at least for the people who are contacting our office, there seems to be a great deal of kind of unanimity about, since the experts seem to be advising that the best way to control the pandemic quickly involves, in effect, uniform rules and treating, treating things like whether I can eat inside or outside, or whether I can get my hair cut, or, similarly, should the counties be more aligned? Should the state have one set of rules? Your thoughts?
As you know, the Bay Area health officers came out in March with pretty unanimity, a lot of unanimity amongst the orders. And over time, that drifted in different directions amongst different counties. I personally think it's better to have a statewide order. And particularly when the governor came out with his masking order, it made it easier for all of us because a lot of health officials were being threatened at their homes and every place else with regard to the masking issue. So a lot of the more restrictive measures, I believe, ought to be statewide.
So, Dr. Rutherford, as an epidemiologist, what would be your guidance?
My guidance would be, California is a massive state, and I had to explain this on national TV today. It extends from essentially the Pennsylvania-New York border to the South Carolina-Georgia border. It has the population of Canada. What goes on in Modoc County and what goes on in San Diego County are totally different things. It might just be in different planets. And I'm somewhat conscious of the regional differences. I think that the governor's approach about putting people on a watch list and making certain things more restrictive for those counties on the watch list makes a lot of sense to me. For certain things like masking, I think statewide orders are the right way to go. For other things about where you can get your hair cut or not, you wouldn't like to create gradients so that everybody flows across the county, flows across from Alameda to Contra Costa counties. There is a great story, and if I may indulge me for 1 second about masks. There are two hairdressers in Springfield. I'm going to sound like my mother. I'm going to use 1950s language. Two hairdressers in Springfield, Missouri, who went back to work after the Missouri let the lockdown up. Both of whom were infected and both of whom were symptomatic. They provided service to 139 customers, but the customers and the hairdressers all wore masks, and there are exactly 0 transmissions from that. So that is the lesson of masks. If you don't, I can't imagine a more powerful single story that drives home how effective masks are.
Great. Preston, question for you. I wonder how much your different health providers are hearing where people feel afraid to, this whole question of if you're in one of the essential jobs that you have to go to work that is, say, one that you aren't protected, meaning that if you had to leave it for 2 weeks, that you wouldn't necessarily have job protection and such. How much are you hearing concern about that? And how much what have we put into place for folks who are facing that kind of circumstance?
Yeah, this is a very important question as we do case investigation and contact tracing to be able to provide support to individuals, to breadwinners, to families when someone tests positive, to give them the ability to quarantine because that's an important way to prevent the further spread of the disease. We have partnerships with food bank organizations that provide food for someone who has tested positive and is required to be at home and quarantine. And I know the county and the other community health clinics are looking specifically around some sort of cash payment award that can be provided as well, so people can continue to pay their rent or meet other financial obligations without having to fear about going in for their jobs. And again, we can't force employers. The government can't force employers to hold a job position open, but there are employment laws about leave availability for certain types of employers in particular. So that's what we're telling people is that make sure that you you explore what options available, whether that's through leave that's been mandated by the federal government under the CARES Act, or state, employment laws that provide for sick leave and things of that nature. But also, in addition, we're trying to connect people with resources to make their ability to quarantine easier on them and their families.
Thanks for that. I know people would really want our help in that regard. And so, of course, to our two counties, I want to be a partner in trying to effectuate that so that our residents have access to that. And I know the state, we've done some things like with eviction protections and all, but I think we need to do more, and the more clarity we can have as to what would be really helpful and how we can cooperate together, either what state resources might be available. Again, not a guarantee I can deliver them, but what state resources would be helpful and how the county or our cities can play a role too. I think that's very important as we know that this is still going to be ongoing for some time. Now I want to ask our two counties. Lots of folks are needing childcare. We are having more workplaces basically requiring people to have to return, and then our unemployment rules, the furlough rules, all of that. At some point, maybe they won't have to return to work permanently, but they're not going to be able to always work from home. And we know that many workers can never work from home. So what's the status of childcare availability, and how safe is it for our children to be in childcare? Anika and Dr. Walker, and then we'll wrap up.
Well, as you know, we in Contra Costa are following the state guidelines now with regard to childcare availability, talking about social distancing as much as possible within childcare standards, but we're trying to be a lot less restrictive than we were to begin with. I do know, however, that there's been a lot of publicity lately about childcare centers actually going out of business, and that's a problem for all of us. If we lose the available childcare givers that we have right now, we're going to be in deep trouble. So the more we can do to keep them going, keep them in business, to have them doing reasonable infection control, the better off we are. We know that kids by and large don't get sick. We also know that they can transmit, but we don't know the degree of their transmissibility, particularly for younger kids. And so that's the reason why the state is now allowing us to make variances for elementary schools. And I think we ought to pay a lot more attention to childcare centers in terms of keeping them going.
Okay. Anika?
So I think back in one of our early orders in May, we did intentionally broaden childcare for anyone who needed to work outside their home. And so in Alameda County, it is allowed in stable groups of 12. So, and then we have guidance so that, and we have several county agencies working together to make sure that that guidance is available in a timely way, and that we provide technical assistance to the childcare providers as they need it. But I totally agree with Dr. Walker that there are a lot of people who have had to pull their children out of childcare because you can't continue to pay for something that you're not actually using, right? And so it's just we will absolutely need to support that sector. But for the most part, with allowing camps and childcare, we've tried to keep that option open. And so as long as it's groups of 12 for a minimum of at least 3 weeks together, they're their own childcare unit.
Thank you. So Anika, if my normal childcare provider is no longer in service and I'm in need of childcare now, is there either a website or is there somewhere I can go to find out what childcare may still be open or available?
Yeah, you can go to the Office of Early Care, is our Alameda County Office of Early Care. And so they have been our lead agency. And then First 5 Alameda County is also really connected to the childcare space and the network of childcare providers. And so agencies like Bananas comes to mind because that one I can always remember. And so see, you can, Google emergency childcare for Alameda County, and there are matching services available.
Great. And I'm assuming similar for Contra Costa County?
Yes, especially First Five as a resource. It's a place to go to get knowledge about how to get childcare and what quality childcare is all about.
Great. All right, well, our time's up now. Preston Dufouchard, the CEO of the West Oakland Health Council. I want to thank you. Anika Chowdhury from our Alameda County Healthcare Services Agency, Dr. Walker from Contra Costa's Healthcare Services Agency, and Dr. Rutherford, the epidemiologist who had to leave us a little early. You really have been giving us some very practical advice. And what I would like to just communicate to my constituents is we can all be safe and we can have a productive life right now in this pandemic if we wear masks, if we get too close to people, and if we, except for those who are in our own household that we live with. And otherwise, we can still see our friends because we are social animals. But when we do see our friends, keep a distance, keep that good distance, and wear that mask. And with that, we could be like a number of other cities, states, counties that have this pandemic, either hardly any virus cases or going down, down, down. And that's what we all want. So I'm Senator Nancy Skinner. Please do that for all of us. And the only reason that all of us who are on this Zoom are not wearing our masks is because we are
Alone.
at home, alone. Yes. So otherwise we all would be. Again, thank you so very much. And thank my staff for helping to organize it, and stay well, be safe.
Thank you.
Thank you.